I have to finalize things. And when I do my presentation on PowerPoint, I do as much as possible in such a fashion that you will get interested in every page that I slide that I click and show to you. And so this is my presentation, and hopefully you'll get interested with this. Let me see, share. Say, can you see it now, all of you?
Yes.
Okay. Let me, how do I work on this? There you go. Okay, so this data basically came from you, and thank you so much that you send this data to me every Thursday before the end of the day. And hopefully, moving forward, we're not going to run after you. Because as I've said, I have to work hard when I get your data. When I arrive home, I barely take my dinner because I have to work on all of this data. I have to get the percentages. So as of 4/16, this is our vaccine tracker for employee. And are we improving? Definitely. Every week we are improving. And if you take a look at this data that we have one facility with 100% and 9 facility with 90% percentage. And 2 facilities with 80% uh, percentages. And we have 2 in the 70s and we have 1 in the 50s. Now I am surprised with Apache Junction because before that they had good percentages. But I am very much impressed with Jim. Jim is very forthright. He's very frank with me and Elizabeth. Joey, if this is the number, this is the number. I'm not saying, implying that my predecessor came up with the wrong data. No, it's just that this is the data that I have discovered. And so there were 59 actual employees that declined. But Jim assured me that he's going to work hard and try to give sense or provide the necessary information for these employees to take the vaccine. And so if you take a look at this, there are also in the waiting column, Antelope Valley Care Center. I have keep watch of Antelope Valley Care Center. Their percentages actually are going up. Tom is doing a good job, of course, equal with the rest of the administrators. But you can see the progression of what Tom is doing. From 68% 2 weeks ago, went up to 70, and now it's 74. And waiting, 27. So if these 27 employees will take their vaccine, trust me, their numbers will go, over the 80s or perhaps close to 90s. So in general, therefore, when it comes to the employee COVID vaccine, Mr. David and Meredith, we are
Amen.
doing good. Now with residents. Residents, we are also doing good, okay, from the get-go. And of course, there will be fluctuations when it comes to residents because of admission and discharges. And so those who were admitted and they were vaccinated and we take their data, once they have been discharged, then we have to exclude them again. So there will be peaks and valleys when it comes to the residents. So if you take a look at Apache Junction Health Center, this one again, the same thing, the same explanation that I did earlier. Jim, thank you so much for being frank to us that this is the numbers that you really have. And so, but according to him, there are waiting 33. So once the COVID vaccine will be made available, his numbers will increase. And based on this data, there are 3 client facilities with 100 percentile. And that would be Golden State, Group Homes, and Pacific Palms Healthcare. And the rest, of course, are the 90s, 80s, and we have 70s, 1, 60s, 1, and we have 40s, 1, which I've already explained later. That's Apache Junction Health Center. So again, in general, we are doing good with our residents. So overall percentage, if we combine all client facilities that we have, with including group homes, despite there being 5, but we consider them as 1, this is where we are right now. So we all know that long-term care facilities, the national average of employees that are willing and took the vaccine is in the margin of 40%. In fact, it's only 35. It plays within 35 to 40%. But if you take a look at this for employees, from the get-go, when we started, we are already above the national average. And if you take a look at the progression here, thank you so much, administrators, and of course your team, we are moving up. So last week, we were at 80%, 82%. And now, this week, we are at 84%. Now, if we go to the residents, we all know that national average is 80%, right? And so now, if you take a look at this, since March 19, we're actually above the national average. So there you are. Both employees and residents, we are doing good. But as Mr. David said, the governing board, our marching orders is to achieve herd immunity in each of our respective facility, it should be 85% and above. So there's more that we have to do. So based on the data that we have, so congratulations. These are the circle of winners that achieve herd immunity, both for employees and residents. Last week and 2 weeks ago, we had 10. Now we went to 9. So Palm Grove Healthcare, because of the residents, and as I've said, it's fluctuating, so they were not able to achieve the 85 goal, so I did not include them anymore for now. So these are the gold winners. We have Country Manor Healthcare, Cherry Valley Healthcare, Golden State, Harbor Post Acute, Heritage Rehab Center, Miravilla, Pacific Palm, St. Andrews, and San Jacinto Healthcare. So other facilities that are not included in the circle of, excellence or champion, you can say whatever you want to say, it can be done by you, okay? It is a challenge. You can replicate it actually. So when it comes to facility leaders, nothing has changed. And so Apache Junction sent in, as per the instruction of your governing board, Mr. David, last week, that those with medical and religious reasons, they should provide documentation. So far, what I received is from Cherry Valley Healthcare, Apache Junction, I got 1, and I'm still waiting for the 2, but Jim said to my staff, Elizabeth, eventually he is going to send it in. From Montalbano Care Center, I haven't received it yet. Palm Grove, the 2 religion and 2 medical, justification, the documentation, I haven't gotten it yet, including Sierra Valley and Well Springs. So hopefully, you're listening. You're going to send that to Mr. David as well as to Marybeth and me. Now, I really don't want to delve on this one, but I'm one person, just like Mr. David. I'm an educator. I will not settle for less, but I'm not going to delve into this. But this will just give you an idea how serious and dire the situation is. The World Health Organization Director General, they have seen during the last 2 weeks a spike in global cases. In India, in Brazil, in Norway, people are dying. So we have to, in our own country, we really have to do a lot in order to increase the vaccination of our employees in order we will not be part of these statistics in global cases and global deaths. So there you are. USA still stands number 1 in terms of confirmed cases and deaths. Now back to United States of America. The total cases that we have is 31 million. Total deaths is 562,000. While we are already 500,000, but if you notice, the 500,000 mark actually started around February, first week of this year. But because of the vaccine, have you not noticed that we have not moved beyond 600,000? So what it means, the vaccine is working. Otherwise, in the absence of the vaccine, this could have been, at this juncture, we could be at around 800,000 or 700,000. Now, in Europe, combined all European countries, they're almost 1 million in terms of death. Now, in the state of California, cases, we are at 3.6 million. Last 7 days, 20,000. So we are still having confirmed cases. And that's in California, 59,000. Last 7 days, only 720. I hate to say the word only, because one soul is painful to a family and to all of us. But these numbers looks good when it comes to deaths and including confirmed cases. In Arizona, 851,725 cases. Last 7 days, 4,200. That's in Arizona, okay, 17,000. Last 7 days, they only had 74 deaths. Now, we go to by county. So, if you take a look at this one, and Arizona 12, meaning in the state of the nation, we're talking of 50 states and one, Puerto Rico, and Washington, D.C., 52. We are leading California in terms of cases and in terms of death. While Arizona, they are number 12 in terms of cases, but deaths is not number 12. I guess they're around number 15. Now, in the state of California with 58 counties, LA County is number 1 at 1.2 million. In terms of that, we are also leading at 23,553. Riverside County, you are at number 2, 296,908. And that is 4,514. But when I read the Johns Hopkins University data, actually in terms of deaths, San Bernardino is higher than Riverside. They came in second. It's only in confirmed cases that Riverside County is number 2. Now, Sierra Valley Rehab Center, Tulare County, cases, you're at number 15 out of the 58 counties in California. And your death is 825. Maricopa County, cases, okay, they are number 1 out of 15 counties. And by the way, the top 20 county in United States of America, there are 3,008 counties. LA County, Maricopa County, and Riverside County, you are within the top 20. We are within the top 20 counties out of the 3,008 in terms of confirmed cases and deaths. So Maricopa County deaths, 9,741. Pinal County cases, you are at number 3 out of the 15 counties, 50,417, and your deaths is 964. Jim emailed us this week that they are already in the green area. In other words, they have cases and confirmed cases of less than 5%, I guess. Okay? So, we are in the business of nursing home. So, it's very important for us to know, in general, our resident and staff cases and deaths. So, confirmed cases as of 4/4/2021. Now, this data came from you. Came from all the nursing homes because you submit the data to CDC's National Healthcare Safety Network. Confirmed cases, 645,000. And California has 58,536. Arizona, 6,784. That's 131,584. And California had 9,069. Arizona, 1,209. Now, when it comes to staff, confirmed cases, 566,723. And deaths, we are very low, 1,877. Of course, God forbid, we don't want our employees to die. Albeit, we have 2 of our employees that died. Okay? Now, this one, I just want to go through this in 2 seconds. So, CDC came up with a criteria. They established these classes of SARS-CoV-2 variants. This is very important. You know, I'm doing this for information. This is very educational. So, there is a movement here. So, variant of interest is VOI. Variant of concern is VOC. Variant of high consequence or VOHC. So, what we have now are the different types of variants. In these variants, there are 20 lineages. So, what you see, the B117, the P1, B1351, B1427, and B1429, this is just part of the 20 variants that we have, or lineages, based on the genomic sequencings that, they've been doing, the Public Health Agency. So, the reason why I'm saying this, because it is very important to educate your employees that there are a lot of variants, and the only way to stop these variants, the spread, is to take the vaccine. Okay? So this is where we are right now. If you see the progression, the emerging fast variant in the United States is the B117 versus the South Africa and the Brazil variants. So if you notice, last week we have 19,554. No, only 2 days ago. You see now, the B117 is already 20,915. So South Africa and Brazil, they are less in number. It's just only a quarter. And if you take a look at this, okay, all had the, what's this? We also have the South Africa and the Brazil variants in all of the states of the nation. Okay? Now, of course, in P1, we only have 31. In South Africa, we have 36 states. But the B117, okay, they have already blanketed all of the states and Puerto Rico and including Washington, D.C. Now, what are the emerging variant cases in California and Arizona? Okay, so this is what we have. And so California, as of now, we have 1,001 of the B117. If one or two of our employees get exposed or got infected the B117, he will bring this type of variants in our building, the B117. Arizona, do they have? The answer is yes, 152. Do they have the 351? Yes. California, 18. Arizona, 3. Do they have the P1? Yes. We have 41 and Arizona, 7. In Brazil right now, their hospitalization and deaths, it's really going extremely high. They are in a very desperate situation because of the P1. Okay? Now, so if you take a look at the proportions of SARS-CoV-2 variants of concern in California, Arizona, remember, variants of concern, we are not anymore in the variant of interest, but we are not also in the variant of the high frequency cases. So if you take a look at this, the B117, around total, we have California's 15.9%, meaning the UK. But for the South African variant, it's only 0.3%. But take a look at this. The B1427 and the B.1429. This is the California variant. And more than 50% of the cases in the United States is in California because this is the peculiar type of variant that we have here in California. So I'm bringing this matter up to you because perhaps our employees conventionally, their thought is, their conventional wisdom, it only pertains to the wild virus, the current COVID that we have. They should understand that there are a lot of variants. Okay? Especially in California, we have these two peculiar variants. And the only way to stop the spread of these variants is to get inoculated. Okay? Now, but generally speaking, in United States of America, the most predominant, almost 50% is the B117. And if you take a look at this, the two California, the B1429 is already at 6.9%. So California, in all of these variants, the total sequencing, okay, genetic sequencing that they did and came out with the result is 6,919. Okay, I'm doing this to all of you just to entertain you, okay? So that you'll not get bored. Okay. And so, with the 332 million in United States, so how many vaccines were delivered? 258 million. More than half, more than 50%. But what was administered is only 202 million. So one dose of vaccine, 127 million, we are now at 38.5%. 38.5%. So we are looking at, because now it is an open season. Okay, no more tier 1, tier 2, or priority A, priority. No more. It's an open season. All adults are now, they can take their vaccine. So, ramping up all of this vaccine, okay, Pfizer, BioNTech, and Moderna, and unfortunately, but it's not unfortunately, definitely Johnson & Johnson will resume. It's just out of abundance of caution, okay, they will just study the data. So you see, we're almost there, 38.5%. That's why we're looking at around July, Independence Day, more or less, to achieve more than 50%, but closer to a herd immunity, and herd immunity is at least 70, 75% to 85%. But for fully vaccinated 80 million, we are now at 24.3%. Now, in terms of demographic, who among the age bracket took the vaccine? If you take a look at this, the 65 years old and above, 80.4% versus the 18 years old and above. Okay? They're only just half of them. But understandable because the priority were, of course, the 65 years old and above. Fully vaccinated 18 years is 31.1, but you take a look at the 65 years old, it's 64.6. All of these are CDC data as of 4/16. Now, we'll go to California, which we are very much interested. How many were delivered? 31 million and administered 25 million. And we are at 39.9 million. But remember, this is not Johnson & Johnson. We have 2 shots, so it should be twice. Okay? So 1 dose percentage total population, we are almost 50,000. 50%. We are now at 41.7%. Sorry for the typo. 41.7%. California's blueprint for a safer economy. On June 15, we are looking at opening all establishments in California based on this vaccination progress that we have. But of course, we are not going to dispense the public health measures. We will still wear our mask, okay? Distance 6 feet, and of course, regular washing of hands. But we are looking at a possibility that by June 15, we don't have to social distance for as long as we are going to wear our mask, okay? And so with Arizona, where are you right now? Out of the 7.5 million, 1 dose is 36.6%. And then fully vaccinated is at 23.4%. Now, so if you're interested to know who among the vaccine types, okay, we had in terms of the numbers. So Pfizer BioNTech, in terms of numbers, they have 129 million versus Moderna 111, and Johnson & Johnson, before we had the pause, they had 17 million vaccine. Now, but as to administration, Johnson & Johnson is stopped at 7.8 million, right? 7.8. But a lot of the population took the Pfizer BioNTech at 105, and then Moderna at 89. So those who are fully vaccinated, most of them actually had the Pfizer BioNTech at 39 million, and Moderna 33 million, and Johnson & Johnson 7.7. I don't know what this unknown, but we don't allow other vaccines from outside the country to be used here. The Sinopharm, Sinovac, the Gamaleya, Sputnik 5, no, that's not allowed here. Okay, so we'll talk about the long-term care facilities. Doses administered, 7.7 million. 1 dose, 4.8. Fully vaccinated, 2.8. So in California, what were administered? 836,000. 1 dose, 495,000. Fully vaccinated, 333,000. Our numbers are good when it comes to long-term care. Arizona, you had 125,000. 1 dose, 81,000. Fully vaccinated, 43,000. These numbers that I'm presenting to you, this is very important. Because in one of the occasions when I was in Pacific Palms Healthcare, literally speaking, I was harassed. I was verbally abused by one of them. And you know what she said? You came here and you talked to me about this data. Can you kindly provide me this data? In other words, I should have brought the data. But I was not prepared. I was not prepared because Lance just told me, Joey, there are 7 or 8 of them. These are refuseniks. They are hesitant to take the vaccine. And if you can kindly meet with them. So I took the opportunity. So I learned my lesson. I can rattle off with all of this data, but if I don't have that in my hands, there are 1, 2 of them would like to see the data. Okay? Okay. So, as to residents, 1 dose, 2.1 million, staff, 1.5 million. And those fully vaccinated, 1.4 million, residents, staff, 1.0 million. This is not good, okay? This is a shame. Would you imagine there are more employees than our residents that we are taking care of? Okay, in terms of ratio. And yet, the residents, all of them are believers in vaccines. They had 2.1 million, and the staff, you see the difference? 525,000. There are less of our employees taking the vaccine. Okay? Not only the 1 dose, but including the 2 doses. Fully vaccinated, close to 500,000. That's the disparity. In other words, the residents are more concerned of their health versus our employees. As Mr. David said earlier, you know, it's our employees who are the carriers. Because the residents, they are just in the building. They're not mobile. They don't leave the building. It's our employees who brings this. So hopefully you can provide, in one of your meetings with them, tell them that that they should take the vaccine in order to prevent bringing this type of the virus, including the variants, the possible variants. This one, just to give you an idea, for the past week, okay, actually had an uptick in terms of cases, confirmed cases in United States. You see? If you see this graph, the red, it's going up instead of trending down. We were down 3 weeks ago and now it's going up. And this is concerning. Now, new deaths, okay? Instead of going down, we were down 2 weeks ago or 1 week ago, and now we are moving up. Okay? Why? Because we need the vaccine and most of them do not want to take the vaccine. It's all about the vaccine. Okay? Now, for California, okay, new cases as of 4/15/2016. 7 days moving average is 2,963. New deaths, good news, although this is bad because it's death. 132 deaths. 7 days moving average, 102. What did I say last week? If your 7 days moving average, okay, is more than your new deaths, your deaths or confirmed cases, meaning we are doing good. Okay? So in this instance, for both, okay, for new cases, if you take a look at this, new cases is 2,016, 7 days moving averages is 2,963, meaning in terms of cases, we are doing good. It went down versus the averages during the last 7 days. Okay, for Arizona, new cases 460, 7 days moving average 600, doing good because your new cases is over the 7 days average. New deaths 14, 7 days moving average 10. Okay, we're almost there. So all of us, we knew regarding Johnson & Johnson that there was a pause. As of April 13, CDC and the U.S. Food and Drug Administration recommended a pause. Remember the word pause, not stop or to take it out from the market. It's just a pause. So in other words, when it's a pause, then we can just play it again. Okay? So in the use of the Johnson & Johnson COVID-19 vaccine. Why? Because almost to the 7 million doses that they have administered, there were at least 6. All of them were women. All of them are women. Okay? 6 of them. Okay? They noticed they had a rare and severe type of blood clot. Okay? After receiving the J&J vaccine. Now, is it reactional? Is it overreacting? Are we overreacting? Is CDC and FDA overreacting? The answer is no. In fact, we should commend CDC and FDA. I'm saying this because you can use this as an argument. Meaning, these agencies, the public health agencies, they are mindful of the safety of the population. Because if they're not mindful, with just 6, perhaps they can just say, well, it's just an isolated incident. Who cares? Perhaps it doesn't have any direct correlation with the vaccine and with the side effect that they had. This is what happened with Sinopharm and Sinovac. And this is what happened with Covishield and also with Gamaleya Sputnik 5. Despite the cases, okay, we're not only talking of 20s or 50s, thousands, and yet they did not post this vaccine. They continue on using the vaccine, except AstraZeneca. Countries in Europe now, they stop AstraZeneca. They did not use the word pause, they used the word stop, and even in South Africa. But here in United States for Johnson & Johnson, what we did was just a pause. Because mindful of, uh, of the data that we have. 6, it is very much concerning. So they need to review most of the data that they're going to get in the days to come. So all reports occurred among women between the ages of 18 and 48, and symptoms occurred 6 to 13 days after vaccination. The issue of blood clotting, with or without the vaccine, you always remember this. You are going to die as a result of the COVID, okay, due to blood clotting. One of the causes of the death of COVID-19 is blood clotting. So with or without the vaccine, if you got COVID infected, one of those primary drivers would be blood clotting. So the use of this vaccine is paused for now. This is because the safety systems that make sure vaccines are safe receive a small number of reports of a rare and severe type of blood clot happening in people who got this vaccine. And so the experts that are looking into this is not CDC and FDA. Because if they will be the one who's going to do it, then they will be biased, right? So what we have are the experts in the field. So we're talking of epidemiologists. We're talking of virologists. We're talking of immunologists. These are independent experts. Just like the recommendation for the 3 phases of the clinical trial of this vaccine, they are going to study this data. So once they are done digesting this data, the recommendation is not going to stop. The recommendation is to continue, but with a caveat. Perhaps they will say, well, women in the ages of blah, 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 okay, you have to confer with your, consult first with your primary care physician. There will be a caveat, but to continue, definitely we are going to continue the resumption of this type of vaccine, the Johnson & Johnson. And so, for now, we have to be very extra careful. If we have them in our refrigerator or in our storage, please pause. Do not use the Johnson & Johnson until such time we hear from CDC and FDA. So this is just, I got this from Johns Hopkins University. So what you need to know, does it mean that the vaccine is unsafe? The answer is no. More than 7 million, the 6 is only 0.000.7%. Yes. More than 7 million are safe. There were no side effects. So the balance, therefore, this vaccine is safe for most people. And will not cause any severe adverse events. Okay? But we are just pausing in order to review the data so that they can come up with an accurate information and then come up with the recommendations on how to move forward with this vaccine. And this manifests, a pause manifests that it is good news, meaning that the system is working, meaning CDC and FDA, which we are paid to protect the public's health, they are doing their job. Otherwise, they don't care. They will not care. Let's move forward. It doesn't matter. So that is the kind of information that we are going to share with our employees. Okay? So, you got the J&J vaccine. Should you worry? You don't have to worry, generally speaking. Not unless you're experiencing side effects. And you can see from this particular slide. And in the meantime, what are you going to do? So, we don't have to worry. We will continue the jobs that we have with Pfizer and Moderna. Because with the 2 vaccines, okay, there are no medical issues as to its side effect. But the only problem here, because of this pause, there might be a concern, especially those in the middle, okay, the movable middle. The movable middle. So what does the movable middle means? Because this was initially what Mr. David said and Gonzi. There is no question, okay, based on the data that we have group of employees who refuse. No argument, no matter of incentive, even though we're going to bribe them, they're not going to take the vaccine. Okay? And there are those who are undecided, 11%. If you can take a look at this particular slide, this came from the Kaiser Family Foundation, okay, where initially she said now it's too early to measure whether the pause will affect vaccine hesitancy among long-term care staff. There's a limited data, okay? But what we are concerned most is the movable middle. Because this movable middle, okay, they compose a large portion of the population. They can be moved. The needle can be moved towards taking the vaccine despite their initial hesitancy. Because Johnson & Johnson, compared to Pfizer, BioNTech, and Moderna, we all know this is only one dose, one shot. Okay? And the science of vaccine, throughout their lives based on history, they know it is only one shot as it relates to science versus the one that we have where it requires 2 doses. So this movable middle, we are going to take a look at this if they are going to backtrack because they're almost there, willing to take the vaccine. And because of this pause, then perhaps they might retract. So this is an area that we will have to take a look at, and if they will approach you, then use all of the necessary information that I have shared with you. Okay? But no problem. You can tell them that despite the pause of Johnson & Johnson, as of April 15, no cases have been reported among the more than 200 million people who received the Pfizer, BioNTech, or Moderna vaccines. Yes. That's why the platform mRNA, okay, it is a miracle compared to the viral vector, compared to the live attenuated type of vaccines. mRNA is really very effective. Very effective. And so even though we have a pause, but with Pfizer, BioNTech, or Moderna, we can still achieve our target. We can still achieve our target. There will still be continuous logistical delivery, millions. We are now having more than 4 million a day. But on an average, we are having 3.5 or 3 million of vaccines being inoculated every day. Other countries around the world, they envy us because of Pfizer and Moderna, because what they have are not these 2 type of vaccines. We have to do it first here before we are going to share it around the world. Although we made a commitment with COVAX facility, World Health Organization, with 4 billion worth of Pfizer, BioNTech, and Moderna for the poor countries, and including the middle income countries. So the new figures from the cities suggest that the authorized COVID-19 vaccines are nearly perfect at preventing death as clinical trials have suggested. You see the word? Nearly perfect. With 74 fatalities in 75 million people fully vaccinated, only 74 fatalities, meaning the vaccines appeared to be 99.9% effective. If you have this data, and here comes an employee who's going to argue with you, use this against them. So done with the vaccine, Mr. David and Mary Beth, and you have indicated that I should share with them the performance evaluation. If the name of your facility will appear here in resident and employee, including GLPL, the intention of the governing board, the Merivet, and myself, risk management, is not to embarrass you or to humiliate you. But the purpose is in order to challenge you. In other words, if your scores are low, meaning you and your team should work hard to improve, your numbers. So we'll start with the employee arbitration agreement. Okay? This is as of December 31, 2020. And I was supposed to share this with the governing board and to my supervisor last January, but because of a lot of things, this pandemic, so I only submitted this to them yesterday. There is no problem. We are the best when it comes to employee arbitration agreement. There was never an instance, believe me, in my 15 years or 16 years when we implemented the mandatory arbitration agreement, where we had a labor claim or a case where we didn't have an employee signing the arbitration agreement. Even our lawyer Jim Ball said, Joey, impeccable what you are doing. Because he had clients, okay? He has a lot of clients in California where they had cases where they don't have a signed arbitration agreement. But in our case, if you take a look at your number, 100%. Perfect, perfect, perfect. In Wellsprings, if you see an asterisk here, I did not include anymore the name. There are 2 of those employees, holdouts. For years, they refused to sign. So that's why their score, 2, refuse, 99.4%. And Mr. David, Maribeth, all of us knows, if an employee refuses to sign, trust me, 99.9%, he is going to file a case. Okay? Meaning a civil lawsuit. A civil lawsuit. Is that they're not willing to go into arbitration, but a civil lawsuit. Now, this one goes into the core of your operations. You can earn a lot of money, okay, for a particular quarter or for the whole year. Everything will go to waste if you have a lawsuit. The one that would protect us from a lawsuit, because we can not stop family members or anyone to file a lawsuit. But the shield that would protect you, the word is to mitigate our exposure, financial exposure, through an arbitration agreement signed by the resident, if competent and able, or signed by the family member or the spouse with a durable power of attorney. If you have that, I'll tell you, our lawyer will say that this is not only defensible, but it will cut your cost. So if you take a look at this data that we have, my friends, ladies and gentlemen. So these are your data. These are your data. Are we doing good in general? To me, the answer is yes. Because a lot of you are in the 90s and we have 80s. Okay? Of course, Group 1 is understandable, 0%, and also Golden State. Okay? Because the kind of residents that they have, okay, most of them are conservator, and not only that, it's the regional. I understand that who makes decision for them. And so, you take a look at this, go through this, digest them, and hopefully moving forward, you're going to improve your numbers. This is the only way. And you must remember, in these pandemic times, I'll tell you, once the pandemic will end, and most of the states, and especially California, there is no such thing as immunity from lawsuit pertaining to the COVID. We cannot say, well, because, we were professionally negligent, okay? There was death of this resident because of the COVID. There's nothing that we can do. No, my friends, you cannot use that. Cannot. Okay? The standard of care still requires that. But the only way that could mitigate our exposure, if you had this resident sign the arbitration agreement. Yes. So, very important that you have to advise your marketing and admission that handles this for them to work on the arbitration agreement. Now, this is the last slide. So, this is the consequence. If you are put in your arbitration agreement, you will end up with an exposure. Again, the intention is not to embarrass you or to humiliate you. In fact, if I'm administrator, if my facility is here, I will even be humbled. I will take this as a challenge. If my facility is shown here. And if I have 5, will I be embarrassed? No. In other words, I have to assume responsibility and deal with my staff that we have to work hard. Because as I've said, we cannot stop from lawsuits. So if you take a look at this is year end of 2020. We have actual, lawsuits, and on the other area here, you have potential lawsuits. Remember, potential lawsuits will lead to actual lawsuits. Potential lawsuits initially starts with a request for records or a subpoena for records. So once the family member or the lawyer will get the records, they review it, and they have seen, that there is problems in documentation or the services provided to the resident, I'll tell you, it will now become an actual lawsuits. On an average, when we secure the services of a lawyer, I'll tell you, it's around $75,000. Okay. Now, when it comes to settlement, on an average, in the past, based on the data that we have, is 250,000. My friends, ladies and gentlemen, it's not 250,000 anymore. It went as much as 375,000 if we're going with the averages of based on the last 5 years. By the way, this is last 5 years data, okay? So that is how it works when it comes to liability claims. So it's very important then for us to work hard. If we're only thinking of the survey, we're going to pass the survey. If you're going to do your best in the survey, okay, because it pertains to documentation. It pertains to your policies and procedure, compliance to your policies and procedure, updating your policies and procedures, all of that. You know, it will have a positive effect on our cases, because if there is a case pertaining to that particular resident and you are working on all of that in preparing the for the service, it will also help our lawyer in defending the case if there is a lawsuit. Okay, and so hopefully moving forward it will reduce the figures that we have here, and we will continue on tracking all of your cases. Okay, so that's it. I'm sorry if I took much of your time.
No,
And
it's
so
important.
I am already done, Mr. David.
Thank you.
You're welcome.
Thank you.
You're welcome,
Anyone
Beth.
want to say
Joey,
something?
can I
Thank you very much.
statement, please?
How do I
Yes, sir.
remove this one now?
Mr. David and Joey, can I mention something, please?
Yes, Sin.
Yeah, okay. When you are getting the arbitration agreements from your residents, make sure that if the resident is not competent, if you have a competent resident, they can sign it themselves. But if you're having somebody else sign in the resident, make sure that either they have an advanced health care directive or a healthcare power of attorney. A general power of attorney, a DPOA, will not be sufficient. Or that you have permission